Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the histology of the loose areolar connective tissue. What are the identifying points? It is a connective tissue, so it should contain the connective tissue cells, fibers, and ground substance. So we look at that. These are arranged loosely. So we have cells, fibers, and the ground substance. And the cells are distributed among the fibers. Okay, and the ground substance is a gel-like substance. So the cells will be embedded there, the fibers will be embedded there. So we are seeing here the collagen fibers present here. We have also elastic fibers, the blood vessel like capillary containing RBC. It is also nerve supply, and it contains multiple type of connective tissue cells like that of the fibroblast. We have the fibroblast here. This is the fibroblast. Another one, fibroblast. This fibroblast are the active cell. We have also fibrocyte. Those are a little bit less active. These cells produces the ground substance and the fiber. We have the plasma cell that produces the antibody ground substance. They are loosely arranged. So this is a slide of loose areolar connective tissue. So if you go there, this is a site of loose areolar connective tissue that is underneath the epithelial cell. This is the glandular epithelial cell, and this is a part of the gland. So here is the loose areolar connective tissue, the fibers, cell, and the ground substance, everything is loosely arranged. Then after the loose areolar connective tissue, there will be continuity to that of the dense irregular connective tissue here. So this contains multiple connective tissue cells and the fibers and the ground substance. The functions of the connective tissue cells are to support other structure which are under pressure and have low friction, and supports the microvasculature and nerves, and contain immune defense cell, like it contains some of the lymphocyte, it contains the plasma cells. Those are associated with the defense of the body, and also it contains eosinophil, the macrophages. Those are very essential in case of inflammatory response and also for the immune mechanism. Okay, there is another site of loose irregular connective tissue. This is a stratified squamous keratinized epithelium. This is the epidermis of the skin, and just underneath the epithelial layer, we have the subepithelial papilla that contains loose areolar connective tissue. Again, we have the connective tissue cells. We have the fibers like collagen fiber, elastic fiber, and the ground substance. So, what are the locations of the loose areolar connective tissue? We have this is located in the papilla, in the subepithelial papilla of the skin. It is located in the mesentery that hold the intestine to the posterior abdominal wall, and also it is present under the epithelium of the gastrointestinal tract and the respiratory system. It is present in the GI tract in the lamina propria that is present just beneath the epithelium. After the basement membrane, we'll get the lamina propria. What is the clinical significance of loose connective tissue? Is because it is loosely arranged, so there is chance of collection of fluid in inflammation. Okay, so there will be edema formation due to any type of inflammation. There will be vascular permeability, and there will be edematic change due to inflammation, especially in the loose areolar connective tissue. Okay, so what are the highlights of loose areolar connective tissue? Composition of loose connective tissue will get the connective tissue cells like these cells. We have the fibroblast fibrocyte, we have the plasma cell, eosinophil, neutrophil, adipose cell, large lymphocyte, small lymphocyte, mast cell, macrophage. Each of them has function. Like fibroblasts, they produce the collagen and the ground substance. Fibrocyte is a little bit less active stage of the fibroblast mature form. Okay, and this is the plasma cell. They produce the antibody, eosinophil associated with allergic reaction. It defends against the parasitic invasion, and adipose cell is containing fatty substance here, fat. Here, this is the nucleus, and this is peripheral limb of cytoplasm. Neutrophil is the most abundant white blood cell, and that come to the connective tissue, especially in case of inflammation. So we have multi-lobe nuclei, the neutrophils. Here, this is the melanocyte. It is usually present in the basal layer of the epithelium, so it contains some pigment. Large lymphocyte, small lymphocyte, they are associated with chronic inflammation. Mast cell, that is associated with anaphylactic reaction, that contains granule that releases histamine, heparin, and slow reacting substance of anaphylaxis. Also, it releases platelet activating factors. This is the macrophage. It has the phagocytic functions. This is the loose connective tissue. These are the cells. And the loose connective tissue may also contain the other blood cell depending on the inflammatory condition. Fibers, we have the collagen fiber, elastic fiber, also reticular fiber. Functions, they support other structure. That is the function. Immunological and defense function, it contains the plasma cell that produces antibody. It has anti-inflammatory function, contains the acute inflammatory cell neutrophil or chronic inflammatory cell, and associated with anaphylactic reaction. Okay, so these are the function. Location, it is present in the subepithelial connective. It is present in the subepithelial papilla of the skin. It is present in the mesentery, in the gland just beneath the glandular epithelium. So it is present in the adventitia of the blood vessels. So there are many locations of the loose areolar connective tissue. Okay. So these are my references. Okay, so that's all about the histology of the loose areolar connective tissue. If you like my video, please support my channel, share the information with your friends. If you have any question, please feel free to ask me. And again, please support my channel and subscribe me. Have a nice day. Bye now.